Well, welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. My name is Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. And our special guest today is Peggy Coakley, President and CEO of Coakley Brothers. We're going to talk to her a little bit about Coakley's journey, and she's going to give us some advice on practical tools and ideas for the workplace. So let's start with our update for the week with Dr. Raymond.
Thanks, Tim, and good afternoon, everybody. This first slide summarizes the various indicators of COVID-19 that we've been following, and I'll run through these quickly. The doubling times for COVID-19 in Wisconsin and in Milwaukee have stretched out to 13.3 and 18.1 days, respectively. Daily growth rates over the last 7 days for Wisconsin, 4.4%, and Milwaukee, 3%. Positive tests in Wisconsin dropped to 9.9%. Milwaukee's tests are pending. Positive tests in Milwaukee were 52, and in Wisconsin were down to 272. Testing capacity remains stable in Wisconsin. ICU and ventilator capacity are adequate, and PPE trends are stable. And I want to remind you that you can find most of this information updated daily on the MMAC's Wisconsin Health and Economy dashboard. Next slide, please. This slide shows that the statewide capacity to test for COVID-19 infections, as shown by the blue line, has increased significantly over the last 2 weeks, with daily testing capacity now at nearly 11,400 tests per day, which is approaching our goal of at least 85,000 tests per week. Next slide, please. This slide shows some important considerations as we consider moving forward with a safe restart of our economy. We'll need to maintain hospital capacity, ICU beds, and adequate supplies of PPE. We'll need to socialize health and safety best practices in the workplace. We'll need to protect the vulnerable, both patients at risk by age or pre-existing condition, and also those who reside in long-term care facilities or who are incarcerated. We'll need to enhance our testing, contact tracing, and isolation of infected individuals. And most of all, we'll need to educate consumers and employees about how to remain safe and to live responsibly in a world with risk. Next slide, please. This slide summarizes an announcement from this afternoon that Wisconsin plans to administer weekly COVID-19 tests to about 10,000 residents and employees in nearly 400 long-term care facilities. That goes along with the theme of protecting the most vulnerable. National Guard units will be deployed to test workers and families associated with outbreaks at facilities, and will also increase free drive-through testing in vulnerable communities throughout the state. Next slide, please. This final slide shows the MMAC framework for workplace health and safety principles, which were summarized by Dr. Laura Cassidy from MCW by reviewing best practices for the Centers for Disease Control and Prevention, the World Health Organization, and OSHA. These involve preparing and protecting employees, customers and visitors, and places and spaces in our businesses. And this type of framework will be essential for restoring employee and consumer confidence as we move forward. And this framework also should provide a good lead-in for Peggy's presentation. So I thank you, and I'll turn it back over to Tim.
Thanks, Dr. Raymond. It's a perfect lead-in to our discussion with Peggy Coakley, the president and CEO of Coakley Brothers. And Peggy, I think last time I saw you, we were at one of those business functions that now would be challenging to pull off because of the lack of social distancing. But to start, why don't you take us through a little bit of the journey that you've been on leading Coakley Brothers through this crisis?
Sure, Tim. My vivid memory starts on March 11th. I was having lunch with Alex Lazary, and I was talking about the Lumineers concert that night, And he was saying, well, I don't think you're going to have to think too much about it because the NBA is in discussions, and I believe they're going to be shutting down either tonight or tomorrow in regard to the next night was a Bucks game. And so that was a pivotal moment to see the NBA take this magnacious move. For me, it spoke so loudly that as a leader, I knew right then and there we had to move, we had to act. And so by Friday, we had shut down the office, and by Monday morning, all of the office staff were working remotely. And at that time, there was a amount of fear that had set in back then that was, you could feel it, it was palpable. And so we started backing off all of our residential moving, commercial moving jobs, notifying our customers, and pushing those to the end of April or even into May at that time. And then there was another conversation, of course, that you had to have with your own employees, from the office staff and then the labor staff. And I would say at that time, you know, communication, it's kind of like going back to 2008 where we had town hall meetings all the time. Well, it was the same thing. And I found myself doing video selfies to send out to my labor so that they could hear from Peggy live and that we could stay in front of it with them and let them know that we're working on this. Maybe not that we've got it, but for right then and there, we were doing the best that we could. And after we kind of settled down in tandem, I guess, we were getting notified by our healthcare clients. They wanted to be reassured we were going to be there for them and able to mobilize to help maybe setting up for the surge that they anticipated was coming. As well, I was on the phone with Joel Brennan to ensure that, to find out, indeed, are we considered an essential business? So all of this was happening very fast. And we followed the lead of really the science, Dr. Raymond being one, and as well as the healthcare providers. So we were quick to get PPE gear, certainly not the N95s. At that time, it was, you know, keep them for healthcare. But we did need to protect our employees. Those who volunteered to come back to work for the healthcare, we gave a little pop in their wage to incentivize them to come back, but we did need to keep them safe. They were afraid to walk onto a healthcare facility's premises at that time. And today, I believe all those quells, you know, the journey is, we're entering week 8 right now. So we've all gotten kind of used to this social distancing. We all have the PPE gear, and we're learning how to live with it as we go forward. But I think the best thing that I've learned again is that clear and concise communication, because for us as leaders, it's so important to, at least perception is reality for others, and to be in front of this and to give that feeling of safety and comfort wherever we can roll it out.
Yeah, very helpful, Peggy, to hear, as we've been doing these webinars, how people in their own companies are working through these decisions in a kind of a multi-layered fashion. You also have some slides here that help companies as they come back online, and as we keep talking about this, building employee confidence and consumer confidence is really going to be key to turning this around. So you can share with us here a little bit about how you're seeing workplaces come back online, both in terms of messaging here and also in terms of how they're going to set up their spaces.
Sure. Well, that's the challenge, is setting up your space. And so, you know, in the last 2 weeks, 3 weeks, there's been a tremendous amount of conversation that I've been on from user groups and industry groups, and nobody really had something that was aggregated to hand to a client to make it easy and consumable to start digesting all of this. And so what I set out to do was kind of to create a kit of parts. A friend of mine locally, Angela Pearson, who owns DPI Splat, I called her on a Saturday and said, you know, what do you think about these decals? And she loved it and knew she could mobilize quite quickly. So, and really from concept to a finished product, we had these in hand in about 3 days, and went to create a video that really put together good ideas that we had come across. For example, the flow within the office, so that you have either everyone walking in a clockwise or counterclockwise flow of walk, so people aren't passing each other and running into each other more than they would have to. And of course, if you do have hallways that you would, how do you stay in your lane? And so these decals are demarcations for how people, you want them to behave in the workplace, because we think we know, but I'm in the office today and people, we're not used to it. We're still getting into somebody else's comfort zone that we may not be aware that we're doing it. So I know that outside of my office, I'm going to have a bubble dot that says, please stand here. And if I want to have a private conversation with that individual, it's my opportunity to invite them in, but I'll have another bubble dot telling them where they can stand. And then it becomes intuitive. The person just knows where to go. So I think these, since we rolled it out just a week ago, we've had dozens and dozens of positive responses. And we really just took a common sense, consumable, pragmatic approach that as you walk your own space, it becomes intuitive how to apply these decals so that people know what they should be doing. And I think as leaders, it is our job to, when these employees come back to work, it's really welcoming them first. And then, that they walk in and they can see readily that, wow, they've thought this out. Okay, I do know how to behave. And this feels good to me. And I feel pretty safe about being here. And that's the response that we want our employees to have when they're coming back into this environment, because they in turn are going to be going home and talking to their families. Well, how was it? Do you feel secure? Does your spouse feel secure that you're going back into the environment and perhaps could bring something home? So these next products, as our company, Brothers Interiors, the designers set out to come up with all the products that we had been exposed to and then really drill down on as many as that we could find. All these products that you'll see in the next few slides, and we have many more, are economical, they're easy to acquire, and they're applicable to any type of existing furniture system that you may have. And so they screw on the bottom, they can be set on top and applied on top. There's movable screens that you can have and place throughout your facility. And again, perception is reality. And so these items give people a feeling of comfort that when they're in their workspace, they feel a little bit secluded. And even if the person next to them clears their throat, they're not going to be saying, oh boy, what was that? Or feeling uncomfortable about it, because that shield is protecting them from the person next door. So we found very quickly that our clientele is clamoring for these type of products, and they're inviting us to work and giving us their CAD drawings where we can sit with them and walk through their space and just be applying very logical, pragmatic applications to put into their spaces that the employees would feel more comfortable than they would if you haven't done anything. And then there's many more things that you can be doing. It's how do you modify the spaces by removing furniture so that only so many people will be sitting in. You only allow so many to sit in this kitchen or in this break area. So you pull the furniture out. Again, you're erecting the physical barriers. You can have people come in staggered shifts. You could have people coming in and half of your employees work these 2 weeks and then they go home for 2 weeks and then the other half come in and work 2 weeks. We are working with companies to assess their points of entry, increase the points of entry so that people have a less of a distance to get to their working space and they don't have to pass everybody coming and going into work, because the beginning of the day and the end day is where, the funnel, where the bottleneck is going to happen. So those are the scheduling changes you can do. Again, limiting your gatherings and how many people in certain places and the signage.
Very, very helpful, Peggy. And as we keep saying, We're not going back to normal, we're going back to the future. And this, I think, helps employers as well as employees visualize what that future workspace could be like, and how you can put in some pretty practical protections that in a sense aren't going to cost an arm and a leg. So let me bring Dr. Raymond back in here with you, Peggy, and Chris, go to questions.
Yeah, really the first question would be good for any of the three of you, I think, is what are some companies doing in terms of staggering shifts and creating space between employees to sort of function in this new normal? And as I ask that, I'm going to drop a link into the chat pane that links to the MMAC website, which has a great example from Quad and also has a great video from Peggy's company.
Peggy, you want to take that?
Sure. I can tell you, well, PNC Bank today, right now, has people on these 2-week intervals where they've been scheduled, where you come in and you work for 2 weeks and then you go home for 2 weeks. And it occurred to me just this last weekend, and we're reading about the diagramming that we're going to have to do that I think is going to be legal, that the city of Milwaukee is setting up. If I get the virus by chance, and I happen to be at work during these 2 weeks, and now I have to notify everybody in my sphere of influence over the last 10 or 14 days, at least only half of my office needs to be considered, and the other half of my office had been working at home. And so those people won't be affected. That might help in the event that the virus, if it does come into my workplace. And for at least for me, I'm looking at this as we're kind of in the second inning, and I don't know if this is a 6th inning or a 9-inning game, but if it's a 5K and we're on a marathon run, you still want to be here at the end of the race. And so to keep all of these things that we've learned for social distancing and now apply these practical applications and be vigilant about them, I think it's going to help us get to that 9th inning.
Dr. Raymond?
Yeah, I agree. And when we reopen, we'll be thinking about staggered shifts as well, and maybe even having teams like Peggy talked about so that you can separate the contact tracing.
I asked you a couple of weeks ago what inning we were in, Dr. Raymond, and I hope we're past the second now.
We're probably between the 3rd and 4th, Tim. We've got a long way to go before we get a vaccine.
I got it. Chris?
Well, that's good to hear, Dr. Raymond.
For Dr. Raymond, we also had a question about whether the medical community has seen a significant increase in people's mental health needs during this time.
Yeah, great question. And obviously, this is a very stressful time for all of us, being isolated and many people not having a paycheck. So the simple answer is yes. And we've been deploying telehealth and telepsychiatry methods to try to reach out. And at least in terms of our own employees, we've been very proactive.
Another question for you, Dr. Raymond. Are you familiar with the Wisconsin Connect app, which apparently is something that UW-Madison has launched?
I'm not.
One last question. Do Wisconsin hospitals have remdesivir yet, or is it on its way?
MCW and Freighter are one of the test sites for remdesivir. So we have that through an approved protocol for research. I'm not sure whether we have it for compassionate use outside of the research protocol. Probably not.
Great. Thank you. And thanks to everybody who asked a question today.
Yeah, thank you again, Dr. Raymond. Peggy, thank you very much for both the information on the journey that you've been through, and also, I think, on some really forward-looking practical steps that every employer can put in place and every employee can look forward to, in their workplace. So tomorrow, we're going to be joined by Lisa Johnson, the president of BioForward Wisconsin, to talk a little bit about the biohealth industry and how they're responding. On Wednesday, we're going to have Mike Levelin, the president of Marquette University, and talk about the challenges with higher ed, and look forward to each day an update from Dr. Raymond on the progress we're making in dealing with COVID from a health and safety perspective. So again, have a safe afternoon. Thank you very much.
Thanks, Tim. Thanks, Peggy.
Thank you, Doctor.